welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for FYI, the Quincy Health Department, a program that looks at various health issues, health concerns, and helps you to stay healthy and, of course, informed. And joining me today is public health nurse here in the city of Quincy, Caitlin Pico. Caitlin, welcome back.
Thanks for having me again.
Always excited to have you on this show. We know that you've developed quite a following. Quite a few people, when I'm out and about, mention this program. Of course, we should mention that the Commissioner of Health, Ruth Jones, had started this program, her and I, back quite a few years ago, and then she kind of handed the reins over to you, and you're doing a fantastic job. So still getting compliments.
Thank you. Great.
We should also mention that this particular program, usually if folks have a topic that they would like covered that we haven't covered, we certainly would honor their request. Possibly they could call the health department.
Yes, I'm always looking for new ideas and really want to know what people want to hear, of course. So they can always call me directly at the health department.
And the best number to reach you?
So my direct line is 617-376-1286.
And we should also take this time to mention that the City of Quincy has a website and the Health Department has a link on that website, or a tab on that website. And on the Health Department page often are there's a lot of information. There may be information about topics we're covering here or seasonal information, but folks are always encouraged to visit that as well.
Yes, because Ruth also is still releasing a lot of articles, so you may be able to access those there. And if anybody needs any information, maybe they saw it in the Quincy Sun and they wanted a copy of it, they can always call me too, because I'll be able to send a copy of those.
That's
always
good. True that I remembered that now, that the Commissioner does have a column in the Quincy Sun newspaper as well.
Yes.
So the website is quincyma.gov. Today, the topic I believe you chose was heart attack.
Yes. So, as like with all these topics, a heart attack, it's very important to get quick treatment. So I feel it's very necessary for people to know the signs and symptoms and what to expect.
So we'll look actually at an outline so you at home can follow along or at least know what to expect. We will start with the definition, then we will move on to risk factors, warning signs, symptoms in women, what to do if you suspect a heart attack, treatment, and we will end with prevention. So Caitlin, it's always a good idea to start a program with a definition of the topic we're discussing.
Yes, so a heart attack, which is also known as a myocardial infarction, it occurs when there is a blockage in one or more of the coronary arteries that reduces or stops the blood flow to the heart. So it's very important to know that the coronary arteries supply oxygen-rich blood to the heart muscle. Therefore, without this oxygen and nutrients, the muscle begins to die. So the damage of a heart attack depends on the size of the area that is supplied by that individual artery, and also the duration of injury. So it's very important to get quick treatment to reduce your overall injury from a heart attack.
And we should mention, and we will in just a moment, have some graphics up so folks can follow along, some images. Let's talk about risk factors.
Okay, so one of the most common causes for developing a heart attack is coronary heart disease. And this condition is characterized by narrowing of the coronary arteries caused by a buildup of fat, cholesterol, and other substances known as plaque. And this slow process is known as atherosclerosis. And when this plaque breaks off, it can cause a blood clot, which would ultimately reduce the blood flow to the heart. And it's important to know that if you do have this condition, often you won't know. So it's very good to follow up with your doctor if you have high risk factors for developing this heart disease. Because what happens when these arteries build up with the plaque, other arteries can compensate to continue pumping the heart.
Oh, okay.
So often it's kind of a silent disease.
Right, right.
So it's important to know and really keep up with your doctor's appointments.
And when this plaque breaks off, it will likely it will create a blockage at some point.
Yes, and if we can pull up image 1, this actually just demonstrates what the plaque in an artery may look like. So if you see in a normal artery, it's nice and open, and then in the narrowed artery, that plaque, especially if it breaks off the side, it can form a blood clot and stop the blood flow altogether.
So that's what we're witnessing here is kind of a major block.
Yes, yes, in this image.
So there are risk factors. We will start with major risk factors first.
Yes. So I had broken them down into 3 different categories. The first is the major risk factors. Second is modifiable risk factors, and the third is contributing risk factors. I'll explain a little bit while I go through. So the first, the major ones, these are risk factors that an individual can't change. So with these, we have increasing age.
I wish I could change that.
Of course, everybody. The majority of individuals who die from a coronary heart disease are 65 and older.
Okay.
Second, we have male gender. Men have a greater risk of developing a heart attack than women do and may experience them earlier in life. And then we have hereditary, which includes race. And since it's an inherited genetic risk factor for cardiovascular disease, if you have a high family history of this, you should always know that you are also at risk. And it's also, according to the American Heart Association, the risk for heart disease is also higher in African Americans, Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans. And this is partly due to a higher rates of hypertension, obesity, and diabetes. So you'll kind of see with all these risk factors, they kind of go hand in hand with each other.
And just as you mentioned, hereditary, talk about maybe the importance of vocalizing to your physician about your family's history, because that clearly would play a part.
Yeah, so many health conditions are hereditary, so it's very important. I know it's not very easy for everyone, but if you are able to identify a family history, like say your grandmother had cardiac disease, it's always very important to let your physician know as much about your family history that you can offer.
Right, because we all know that doctors aren't magicians. They need help too.
Yes, and it's all, with all of these conditions, the main thing is prevention. So if they can identify that you are at high risk, they can recommend certain things to reduce your risk.
Modifiable risk factors, and I love that word. I've never used that word before. So right at the top of that list, stop smoking.
Yes, so all of these conditions can be treated or controlled with lifestyle changes or medication. So to stop smoking, smoking cigarettes increases an individual's risk because it damages the lining of arteries and can increase the buildup of plaque. It's with every condition, smoking is never beneficial, which we always review in every episode. So next we have high blood cholesterol levels, and as this level rises, their risk level rises, of course.
So we're concerned about diet here, I would imagine?
Yes. Diet's a very big, that will come into contributing risk factors also.
Oh, okay.
But if you have a high blood cholesterol level, if these are this is present with other risk factors, including smoking and hypertension, your risk continues to increase. So that leads me to my next one, which is high blood pressure. Because this increases the heart's workload, and it can cause the heart muscle in the arteries to become thicker and stiffer, which would be harder to pump the blood efficiently to the heart.
It's not flexible.
Yes. And then we have physical inactivity. I always mention this, you want to do at least 30 minutes of walking a day if possible. because physical activity is necessary to help control blood cholesterol, diabetes, and obesity.
I'm glad that you mentioned walking, because when people hear about exercise, they think they really need to go all out, but you don't.
No, it's really like the main focus. You just want to do more than you typically do. Like
Okay.
if even walking 30 minutes a day will really help your heart.
And there's potential, if you don't know where to fit that in, there's potential that someone could fit that in during lunch, a lunch hour.
Yes, even if you have like an office job, maybe get up. If you have like a 15-minute break, just get up and walk the building.
Okay.
Like, just try your best to incorporate it a little bit each day. And then the last one, well, there's two more. So we have obesity and being overweight. And people who have excess body fat, especially in the waist area, are more likely to develop heart disease and stroke, even if there are no other risk factors present. And then last, we have diabetes, and this greatly increases the individual's risk. Therefore, it's very important to manage your diabetes if you are a diabetic.
Next, we will look at contributing risk factors.
Yeah, so these risk factors have been associated, but the significance and prevalence are still undetermined. But it's important to know that, like, how an individual responds to stress. It may, because this can be associated with other behaviors such as overeating or increased smoking if
Right.
an individual smokes.
Right, because when you're stressed, you might gravitate toward both tobacco and
Yes.
overeating
Yeah, so
to
that's
calm yourself down, but in reality it doesn't.
yeah. So it's very important to try to manage your stress in a beneficial way, of course. And then next we have too much alcohol consumption, and this can increase an individual's blood pressure, the triglyceride levels, and your risk for obesity. And then, as you mentioned before, diet and nutrition, because this, again, overall, it influences the individual's cholesterol levels, blood pressure, weight, diabetes. So a lot of these risk factors, again, go hand in hand. So if you do increase your exercise and manage your diet, you can hopefully manage a lot of these risk factors at once.
Very good. I see that a lot of this is just simply taking better care of yourself.
Mm-hmm.
A lot of prevention is possible.
Yes, yes.
Warning signs. Okay, so what would one experience when they believe they are having a heart attack?
Yeah, so some heart attacks can come on suddenly and be very intense, but most often start very slowly with mild pain or discomfort, which can begin hours, days, and even weeks prior to the individual's actual heart attack. So some signs to look out for include an uncomfortable pressure, squeezing, fullness, or pain in the center of your chest. And this feeling may persist, or it may be relieved and then come back. So if you ever experience that, make sure you contact your doctor so at least they're aware and they can decide whether they want you to come in or not. You may also experience pain or discomfort in both arms, your back, neck, jaw, or stomach.
I think I've heard the arm pain before, but
Yes.
I wasn't so familiar with the back, the neck, or the stomach.
Yes. So it can come in, for each individual, it can come differently. There's also shortness of breath with or without chest discomfort. And then additional signs include breaking out in cold sweats, nausea, and lightheadedness.
Now, you had mentioned that men are more susceptible, but women also have heart attacks, and the symptoms in women can differ?
So I added a slide for symptoms in women because it is likely that they can differ. So according to the American Heart Association, heart disease is the #1 killer of women in the United States. But often women chalk up these symptoms to less life-threatening conditions such as acid reflux, the flu, or just normal aging. Because with this, like with acid reflux, you may get that discomfort in your chest. So I would really, if you are experiencing these, make sure that you are just working closely with your doctor. If you were diagnosed with acid reflux, just make sure if you are having chest pain that might be intermittent, just make sure you're letting your physician know. That way they can closely monitor you.
Sure, they could rule out
To
a
rule
condition
out,
as
yes.
well.
Because not all chest pain will be a heart attack. So
Yes.
it's very important to work with your physician.
As you're saying this too, folks with the internet, I think folks often will do their own diagnosis, will do their own research. That can be dangerous.
It can be very dangerous. It's best to even consult a professional. Even if you call your doctor's office, they can determine whether you should be seen or not. It's not good to self-diagnose because you can be completely wrong. Because with many conditions, the symptoms mimic the same condition.
Right, right.
So as with men, a female's most common symptom is the chest pain and discomfort, but they are more likely to experience those additional symptoms, which may include the shortness of breath, pressure or pain in the lower chest and upper abdomen, dizziness, lightheadedness or fainting, upper back pain, and extreme fatigue. And even if these are subtle, the consequences are deadly. So if you have any of these, just make sure, again, just consult with your doctor just to make sure you are not having a heart attack.
And heart attacks, I suppose for women as well, more common after the age of 65?
Yeah, so it depends on the individual, of course, and their risk factors.
Sure.
But they tend to happen more often after the age of 65.
But we should mention that if you experience any of these symptoms or any symptoms that could relate to a heart attack or another condition, again, consult your physician.
Of course, yes.
So, what to do if you suspect a heart attack? Top on that list is call 911.
Yes, so immediately if you suspect this, call 911 or your local EMS, which is your local emergency medical services, which could include the fire department or ambulance. It's probably better off just calling 911 though. And this is important because EMS staff can begin treatment right away when they arrive to the scene. And patients with chest pain who are brought by an ambulance are most often seen faster in an emergency room, so you can really get that prompt care.
So
that's
don't
necessary.
drive yourself or have someone else drive you. Go right inside the ambulance.
It's always better to be on the safe side. And then I also wanted to add some additional steps you can take before a heart attack happens. So it's important to be aware of hospitals in your area that have 24-hour cardiac care. If you can identify these, that's okay. If you call 911, they are fully aware of what hospital to bring you to. It's also important to keep a list of emergency phone numbers next to your telephone. That could include your local police, your local fire station, just so that way in an emergency you can quickly dial that number. And then I also think it's very beneficial to keep an updated medication list, medical conditions, your primary care provider, and also an emergency contact. I know this is a lot of personal information, but you can find, even if you put it on a little note in your wallet, or sometimes you can find magnets that are very readily accessible for EMS when they come in. Because especially if you were the one experiencing a heart attack, you're not going to be able to communicate all this information.
Correct. I think there's something called File for Life, I believe,
yes.
that folks can. It's magnetic, so that can go right on your fridge.
Yes,
and
it
house all that info.
Yeah, and it folds up too, so that way if you have guests over, your information's not right out for them to view, because
Right.
obviously you want to keep your confidentiality. So
Sure. Okay, so treatment. So let's talk about someone's had a heart attack. How is that treated?
So there are a couple different things. The main focus is always to restore the blood flow, of course. So the first topic is some medications. So the first one we have is aspirin. So if you call with chest pain, they may recommend right on 911 for you to take an aspirin. Some research has proven that a full-size 325 milligram tablet, you want to make sure this is not coated if you chew this, that will work fastest
Interesting.
compared to like just swallowing the pill. You want to
Okay.
chew it. But you always want to remember, if you are taking this aspirin because you have chest pain, you should still call 911. You
So
don't want to
the-
just take it
the
and think
aspirin's
you're
not the
okay.
answer.
It's not the answer. You still need to be checked out. They may also give you thrombolytics, and these help dissolve a blood clot that's blocking the blood flow. And so the earlier you receive this drug after a heart attack, the greater chances of you surviving and with less heart damage. So again, prompt treatment.
Right.
And then they have antiplatelet agents, and these help prevent new clots and keep existing clots from getting bigger. And then they may give you, if you go to the hospital, you may get pain relievers such as morphine. And they also recommend beta blockers and ACE inhibitors, and these also just make it so there's less pressure on the heart.
Right. Because the idea is to relieve that pressure.
Yes, yes. And then next we have the percutaneous coronary interventions. And these are done typically following a cardiac catheterization. I'm sorry, I can't. All these terms, I'm always messing them up.
Better you
but-
say them than me, because we'd never get through the show if I tried.
But that is to determine where the location of the blockage is. And then once they determine that, they can put a catheter in through the individual's artery, through the groin or the wrist. And what they do, they move that catheter to the location of the blockage. And they can inflate a balloon and to kind of crush the clot or dissolve the clot, and then they can even put a stent in to make sure that for a future that artery stays open. And if we could pull up image 2, that kind of just demonstrates what that may look like. Because if you hear a balloon going into the artery, it's a little confusing.
Right.
But as you can see, as it expands, it kind of crushes the plaque to open the artery.
It creates space.
Yes. So next we have surgery. So some individuals may get emergency bypass surgery at the time of a heart attack, but often you may want to wait 3 to 7 days actually for your heart to recover after the heart attack. And this bypass surgery involves sewing the veins or arteries in a place beyond the blockage or narrowed coronary artery, and this allows the blood flow to the heart to bypass the narrow section. So it kind of makes sense to the name bypass surgery. The blood's bypassing those sections.
Right.
And then lastly on the slide, I just have the dual antiplatelet therapy. And this is for an individual who maybe experienced a heart attack and had stents placed, or who underwent the bypass surgery. And this is just when they use 2 types of antiplatelet agents at once to prevent future clotting.
Now, prevention, which is, I believe, probably the easiest
Yes.
to ensure that you don't end up with a heart attack. Lifestyle is of course key when we talk about prevention.
Yes. So these all go right back to the risk factors. So we have avoid smoking and secondhand smoke. And they say that quitting cigarettes can reduce your risk of coronary heart disease by 50%. So that's huge.
That's huge.
You want to monitor your blood pressure, reduce saturated fats, trans fats, salt, and added sugars in your diet.
So when you're at the grocery store, I suppose pay attention to the ingredients.
Yes, and on a lot of products on the grocery shelves, there will be a little symbol that it is approved by the American Heart Association. So that's how you can kind of, if you're between 2 cans of vegetables, you can pick the healthier version.
Sure.
If you identify that. So again, exercise regularly, maintain a healthy weight, control your blood glucose levels if you are diabetic, take all medications as prescribed by your doctor. If you think they're not right for you, always consult with your doctor, never stop them by yourself. And always comply with medical checkups, just to make sure you are staying on track and maintaining your health.
Very good. Well, I think Well, I know this topic today, heart attack, was well covered. I want to thank you for stopping by.
Of course.
Once again, we'll just let folks know how they can get in touch with the health department.
Yeah, so my main number is 617-376-1286. My email is available on the Quincy MA website. So if you have any suggestions for something you want to see, or maybe you want to rewatch an old episode, always feel free to call me.
Great, and we, as well as putting the program on our channels here, Channel 8 and Channel 9 in the city, it is also on the City of Quincy webpage in the health department, on that health department tab. Folks can watch the entire episodes of the programs we do here as well.
Yes.
Well, thanks again for stopping by.
Thank you for having me.
Well, you're welcome. We'll see you on a different day with a different topic.
Great.
And thank you at home for watching. You have been watching a cooperative program of Quincy Access Television and the Quincy Health Department. Please continue to watch QATV for more locally produced programming.